Hello, my name is Kristin King, and I am a board-certified music therapist, as well as a trainee in the Bonny method of guided imagery in music. And I am here today to talk to you about the Bonny method of guided imagery in music, and to give you kind of an introduction into what the Bonny method is all about, talk about some of the elements of a GIM session, and to talk about how you can pursue training in GIM if this is something that you could foresee yourself doing in the future and incorporating into your work. So today we're going to start with a short music-assisted relaxation. So this is different from GIM, but it's something that most people are more familiar with. So I invite you to get comfortable in your seat wherever you are and just allow yourself a moment to let go. Close your eyes if you wish, or you can keep your eyes open on the screen if that's safer or more comfortable for you. Or you can find a soft gaze somewhere on the ground or on the wall. So just begin by focusing in on your breath. Notice the gentle rise and fall as you breathe. Notice that as you inhale, your body expands out towards the world. And as you exhale, your body moves back towards its center, its core. And as you continue to breathe, allow a sense of calm to enter you. And as you continue to breathe, just allow yourself to slowly take deeper and deeper breaths, as is comfortable for you, allowing your breath to bring an even greater sense of relaxation with each inhale. Allowing yourself to take in what you need and to exhale whatever you don't need anymore. And as you continue to breathe, in your mind's eye, find yourself walking along a garden path. And as you walk down this path, you notice the crunch of the ground as you walk. You notice the smell of the flowers around you. You notice that it's a sunny day and that the air feels warm and comfortable. And there's a little breeze. The sun is out with a few clouds in the sky. It's clear and there are some birds flying by, and you can hear the sound that they make as they fly through the air. And as you continue down this garden path, perhaps you notice a certain flower that catches your attention. And as you notice these flowers, allow yourself to pick one to focus on. Notice everything that you can about it. Notice its color, its shape. Notice the texture of the petals or the leaves. Take note of how many petals you count and the color of the center. Allow yourself to take in the smell of this flower and to breathe it in deeply. And just allow yourself a moment to take in the beauty of this flower and the place where you are. taking a few more breaths in this place. And as the music ends, allow yourself to come back to this space, to this here and now. Feel the chair beneath you. Allow yourself to wiggle fingers and toes if you need to. Hear the sounds in the room around you, or the sounds outside of this room. And come back into this space. So the exercise that we just did is a form of directed music imaging. And it's also a form of visualization. So this is something that you can use with clients who have reality orientation, who are able to follow instructions, who can concentrate on your voice, can return from the visualization, so you don't want them to get lost in the visualization, which is a part of reality orientation, and someone who's able to experience the experience, discuss it, and then be able to communicate feedback as they're experiencing it. So if they're unable to communicate any negative reactions or how they're experiencing it, it may not be the best intervention for that kind of client. So, but for the most part, you can use this kind of intervention or a version of it with most people. I know that I use this a lot in my work with cancer care patients. You can also use it with mental health patients as long as they have reality orientation, and then they're safe, they have resources. So just as long as they kind of have those prereqs, then it can be really useful, and it can support attention, focus, relaxation. Mindfulness is a big one. It can really help people if they're feeling anxious or stressed out, bring them into a more current, present state of mind, focus on their body, focus on how they're feeling in that moment versus worrying about something in the future or in the past. So these tend to be shorter, including the relaxation I did at the beginning is called an induction. So that was, it wasn't too long, but it was shorter. And you can make it even shorter than that. You can just have them take a couple breaths and just move right into it. And then the relaxation itself, you are guiding the client through every step of the relaxation. So you're giving them objects to focus on, you're describing what's around them, you are guiding them through the experience. They're not having to come up with anything on their own. And that way you're creating a safety and a boundary for them to safely experience the imagery. And the purpose of this is more of a supportive kind of intervention. If you allowed more space for them to kind of wander off, as you do in GIM, you're moving into a more depth-oriented territory. So that's just something to think about. So I use the example of walking through a garden, looking at a flower. You could also do something like the setting sun, or a bird in flight, or a waterfall, or walking through a field, or sitting in a garden. You don't necessarily have to be walking all the time. It could just be sitting in one place and really focusing on what's around you. So the music tends to be single pieces, supportive in nature, repetitive chordal progressions, repetitive melodies, something that's really predictable, so it doesn't have a bunch of different changes that it's going to take you off guard or surprise you in any way. Usually really steady, stable, simple, and emotionally inert, which is kind of a weird one because we can't always predict what our clients are going to react to. But for the most part, if you can choose music that isn't purposely trying to evoke some sort of response or emotion, then you're probably more safe with that. So things like very simple classical music or new age music, folk music that's not too complicated, that kind of thing. So within this, your role as the therapist is to actively, keyword, lead the client through the imagery using descriptive language. You can create that in the moment, or you can pre-write it. It depends on the need of the client. One really cool thing that you can do is work with the client beforehand to come up with some imagery that's really important for them. Maybe it's a place that they really feel comfortable or safe, and you can flesh that out with them, what that looks like, and then you can repeat those words back to them within the relaxation. So it's something that you create with the client, but then you direct them through the actual intervention. You also need to be able to redirect negative, or to just manage negative imagery when it comes up. Negative reactions do happen. Most of the time these experiences are really positive, but even with these kind of supportive experiences, negative imagery and experiences can come up. So don't leave the client in the imagery. Tell them that you're there with them, support them, or just have them open their eyes, be back in the space, and help them reorient, and then process with them and talk about what came up. So that is the more supportive directed music imaging, visualizations, music-assisted relaxations, the kind of stuff that we're more used to within music therapy. The Bonny method of guided imagery in music is pretty different. There's a lot of elements that are different than music-assisted relaxation. So we're going to go through each of those so you get a better sense and clarity about this intervention and how the therapists who are trained in this modality utilize the music and the imagery to support inner movement. So I will just read this to you. The Bonny method of guided imagery music is a creative, music-centered, therapeutic approach that invites clients in a relaxed state to listen to specially chosen sequences of classical music, to stimulate spontaneous imagery and journeys in the imagination that are simultaneously shared with the therapist or guide who helps the client to engage more fully with their experiences. Through imagery experiences catalyzed and contained by the music, clients are empowered to explore their inner psyche and integrate mental, emotional, physical, and spiritual aspects of well-being. So that's a definition by the Association for Music and Imagery. So there was a lot in that definition, so we're going to go through that bit by bit. So one of the first big differences between GIM and music-assisted relaxation interventions is the goal. So in GIM, you are supporting depth-oriented work. So you're supporting people to dive deep, to really explore what makes them, their thought patterns, their behaviors, their dreams, their hopes, their thoughts, their relationships, everything, and to look at how all of that works together, it makes them who they are, and to begin to integrate those aspects of the self more. And ultimately, to bring someone who is in a state of unhappiness, of feeling disconnected, of having difficulty in their relationships or in their life, into a place that is more stable, more connected, more aware. So that is a big difference. Whereas in music-assisted relaxation, really the main goal is to be supportive, to be helpful in relaxation and calm, to maybe enhance already present strengths that the client wants to enhance. So GIM also has positive effects on interpersonal processing and growth, like I mentioned. It can enhance the quality of life and someone's well-being. It can also help decrease symptoms of depression or anxiety. It has a positive effect on physiology. It leads to increased acceptance and openness. And GIM can be a great way to address spiritual growth as well. So whereas in music-assisted relaxation, you have the induction and the guided script, and then you come out of it, and that's pretty much it. You might have a preliminary conversation beforehand with the client to talk about what's needed in that day, what's needed in that session. But for GIM, this is kind of the typical layout that you'll see in a traditional session. So the client will come in and there will be a preliminary conversation with the therapist about where they're at, what they need, what has been going on in their life recently, any memories or dreams that have come up that are important to note, and how that's affecting them. It's also important, especially when you're first meeting a new client, to assess things like current medications, any history of mental illness, and to be aware of those things moving in. So once you talk to the client and have that preliminary conversation, you as the therapist are going to decide what music is needed, and we'll talk more about that in a little bit, what relaxation induction is going to be the best for that client and the music, and where are they going to begin. And that's called the focus image. So that's the beginning image before they then are free to image. And we'll again talk about more what that looks like. So there's a preliminary conversation, and then you invite the client to lay down in a comfortable place. Usually there's blankets and pillows and that kind of thing. Allow them to get comfortable, and then you will lead them in a relaxation. So that's the part that you are going to guide, is the relaxation. And then you give them a focus image. So that could be something like a comfortable place in nature, or sitting inside in your room, or whatever is needed for that session. And then the therapist will begin playing the chosen music program. And what makes GIM very different than most other kinds of music-assisted imagery relaxations is that in most other music-assisted relaxations, the therapist will be responsible for guiding the client through the imagery. But in GIM, the client is the one who generates the imagery. So we'll talk more about how that works, but basically the therapist will begin the music, and then they will invite the client to share everything they're experiencing. And so where the imagery goes could be in a million different directions at that point. So we'll talk about more what that might look like. The session within the music lasts anywhere from a short period of time to 45 minutes to an hour. So it can be a very long period of time that they're in the music and that they're imaging. So then what's needed after that is a short period of time for the client to return. So once the music is ended, the therapist helps the client come back to reality, helping them to come back into the current present moment, the here and now. They've just been on this journey in the mind, and now they have to come back to reality and back to their external reality. And then there'll be time for processing. So often this is verbal processing, but this can also be processing in music. It can be processing in art making. Usually more concrete activities are going to be the best way to process, to keep that person back in the here and now. So things often in GIM we'll use what's called a mandala, which is like a circle, and often use materials like pastels or crayons or pens to fill in that mandala. Mandala is just really a blank circle, so they can fill in whatever they are reflecting about from that session. So a little bit more about the induction and focus image. So again, the induction is the relaxation, and the focus image is the starting imagery. So these help the client to enter what's called a non-ordinary state of consciousness. So when the client is imaging within the session in the music, they are not quite connected to our external reality. They're kind of in a alternate space. So this is called a non-ordinary state of consciousness. And this allows them to access their inner world. And it's the part of us that's more difficult to access through talking. And that's why music and imagery can be a great bridge into the psyche and a way to access some of that material. So when we're in a non-ordinary state, there's several things that happens. Our critical faculties recede. We loosen control. So that's good because our analytical mind can loosen and allows us to explore more freely. We experience timelessness, so there's a sense of time going really fast or really slow, and it's not connected to reality time. And our self-image can be altered. So our feeling of ourself and our body, we might feel really stretched out or really small or like a giant. And so our actual feeling sense of our body can change, which is really interesting. So let's talk more about the music. This is one of the biggest, most important parts of GIM. So you may have heard me say music program, and that's because GIM uses programs of music that have been pre-selected in groupings that have been found to work together to facilitate different kinds of experiences. So these programs tend to be between 3 and 6 pieces long, and they were specially listened to and selected, even down to specific recordings, for their cohesiveness together and to facilitate different types of journeys. So before the session, before the music, the therapist is going to consider what kind of journey does my client need to go on today based on where they are, and they're going to select a program to fit that need. So the music, opposed to the assisted relaxation music, which needs to be really stable and consistent and repetitive and not surprising, this music is the exact opposite. It needs to be dynamic, it needs to be moving, it needs to be inspiring, it needs to evoke emotion. There might be music that kind of feels like it's calling you. And so this kind of music is important because it's going to facilitate, again, many different types of experiences. It's going to help you move into the experience. It's going to help you interact with your imagery, and it's going to also evoke imagery. So music becomes a metaphor for your experience. The more complex the music is, the more complex your experience can be. So interestingly, in the traditional form of GIM, the only music that is used is music from the classical canon. And this is because it's been found to best support depth-oriented work. So that's because classical music uses a variety of instruments and timbres and tones. So it's creating all different kinds of elements to interact with. It has more complex tonality and harmony, more complex rhythm structures and layers of sound, and it has small and large ensembles. So all of this can create different kinds of spaces. So maybe a really large orchestra or ensemble will create a large container for someone to move around in, versus a small pared down quartet is going to be a much smaller space to move around in. So it's kind of this interesting metaphor, or you're using music elements as a way to describe different kinds of imagery spaces. So music acts to help generate the imagery, and the client is the one generating that imagery from their own mind. So the music helps this process by enlivening the imagination and stimulating the imagery. The music evokes associations and projections. So there might be something in the music that the client hears that reminds them of something else, and then that emerges in the imagery. So it could be something like maybe a flute line reminds them of a bird, and so that bird suddenly is in their imagery. So that kind of crossover. The music is there to enhance the imagery. So maybe in the imagery, you're going down a river, and the music suddenly starts to pick up pace. So the water starts moving faster. The music is moving faster, you're moving faster, and then your imagery takes that further and you go down a waterfall. So the two become connected and they kind of interact with each other. The music also provides direction, so it helps the client move through and forward in their imagery. And it structures experiences too, so like providing a space and a boundary for them to safely explore in. And as well as moving into imagery, the music also helps the client move into and through experiences. And this is especially important for more difficult experiences, because instead of the client getting stuck in that difficult space, the music is going to help them interact with that challenge in the imagery and to find a solution and to move through it. Or the client's going to get stuck there, and maybe that's something that you have to work with later in a different session. And the music also supports paradoxical experiences and emotions. So we know this from using music in improvisation, that music is able to support many different kinds of experiences at once. So maybe you're feeling frustrated and joyful, and the music is complex, so it's able to support both of those emotions at the same time. So what is actually in this imagery? What could come up? Really, this comes down to the individual. It's going to be different for every single person because it's coming from their own mind. But there's different ways that we can describe imagery that's generalizable to most people. So imagery tends to be a natural expression of the self. So it's an expression of your experiences, your emotions, your identity, your relationships, really anything that makes you you can be expressed in the imagery. Imagery is expressed in images and symbols and patterns and memories. And when we think of imagery, we often think of the visual kind of imagery. But imagery in your experience is not limited to visual. It can be any of your senses. So it can be visual, it can be auditory. So maybe you're hearing the sound of a bird. It can be a feeling. So maybe it's the feeling of wind on your skin. It can be a taste. It can be a smell. So any of your senses. It can be kinesthetic. So that's the feeling of moving through space. So you could be falling or flying or swimming. It could be somatic in nature. Somatic is a feeling within the body. So it could be a feeling of getting really large or getting really small, or warming up or getting really cold, anything that has to do with the body. It could be emotional. So emotions are imagery as well. Anything that falls into that category. And then there's transpersonal imagery, which basically means the self is being transformed into something outside of the self. So if someone has the feeling of turning into a bird and suddenly they identify completely with that feeling of being a bird, that would be transpersonal. Another type of imagery you might have is memory. But what's interesting is that when memory and the imagination interact with each other, the memory may be altered or changed. So although you might remember something a certain way in reality, and you know that to be true, when you bring that memory into the session, into that imagery realm, it can be altered and changed. And what's really amazing about this is that when there is a memory that causes a lot of challenge or struggle for somebody, it causes anxiety or trauma, that memory can be changed and altered into something that's more manageable, that is something where they come out the other side as having overcome in some way. So that can be really powerful. So while the imagery is often positive, it can also be more challenging or difficult. And the challenging and difficult imagery is going to be a working edge for your client. It's going to be important for them to work with, and that's partly how they're going to make gains, how they're going to grow. But the positive imagery is really important as well, and it helps them to connect with a sense of confidence, of self-assurance, understanding. So both are important, and just know that both can happen. So as you're imaging, as the client, you will feel as if the imagery is both happening to you and that you have choices. So this is something that can be a little difficult to learn at first, and why it can take a couple of sessions to really get comfortable with the GIM process. So as you're imaging, as the client, as the music is helping to evoke imagery in your mind, there's a sense of the imagery happening to you, like you're watching a movie of yourself and you are in the movie and it is happening. But at the same time, you have the power of choice within the imagery. So if you come up to a door and you're experiencing and really paying attention and noticing the door, but you're not really going anywhere with that, the therapist, and we'll talk more about this in a second, but the therapist might ask you, is there something you want to do? And you as the client might realize, oh, I want to open that door. Is there a way you can do that? The therapist might say, and maybe you reach out and turn the doorknob and open. So while it feels like the imagery is happening to you, there's also a sense of you having choice and you being able to move the imagery along in a way that you need. So the imagination is very powerful. It helps us to bring what's unconscious into consciousness, and the music can help us do that. But it also provides boundaries that keep us safe. So our brain knows what we need, and if there's something that's too scary or too dangerous for us to go into, our imagination, if it's healthy, will keep that boundary and won't let us move into that area. And that can come out in the imagery. So it might present itself in some way, like everything being really dark or a giant boulder that you can't get around. And there may be a reason for that. It may be because you're not ready to go there. So the imagination actually when it's healthy, can keep us safe in that way as well. And our imagination provides a more complete representation of our experiences and emotions. So we often talk about fact and reality, and we talk about fact as being reality. But when we talk about the imagination, what we feel and what we experience is often more real to us than what may be fact. And that's true in the imagery as well. It may not always be logical. It may not always make sense, but it's going to feel real to you, and that's what's important. And the Imagine allows things to be flexible, to morph, and to change. So what does the GIM therapist do? And by the way, in GIM, the therapist is often called the guide, which is funny because they don't do a ton of guiding in terms of directed guiding. However, they're the kind of guide who's there to kind of nudge you along, help you make suggestions, that kind of guide. So the guide determines the induction, so the relaxation, the focus image, and what music is going to be chosen based on where the client is at on that day. They are there to be the clinical and music expert, so you have to know your music really, really well in order to make those kinds of choices about what music is needed. You're also there to act as a tether, so while the client is imaging, you are rooted in reality, or at least 1 foot in reality, so that if you need to, you can act and help pull them back into reality. You're there as a safety. You're also there as a witness and a scribe. So as the client, while you're traveling, sometimes when you come out of that and you're back in reality, it can be hard to remember everything that happened because it's almost like a semi-dream state. So the GIM therapist is there to help be the witness, to help you remember what happened, to help you integrate what happened, and to also write everything down as it's happening so that there is something to refer back to, because there is a lot that happens. The therapist is also trained to effectively assist the client as they navigate their imagery experiences. So that means if something negative comes up, if something positive comes up, if they're just exploring, knowing what to say, what are the best verbal interventions here, what's going to help this client not harm them, and what's going to be supportive and not leading. So some of that can be kind of a fine line. And so that's a part of the GIM training, is learning how to interact with clients, learning how to support them and guide them. And you're there to help facilitate the therapeutic process. So helping them to make connections between sessions, to kind of act as that anchor between all of the experiences that this client has and help them to integrate their experiences. So the client is called the traveler, the guide and the traveler. So the client, who is the traveler, they need to be oriented to reality as well, with no current or recent psychosis. This is really important because someone who's experiencing psychosis or doesn't have reality orientation would not be safe to go into their mind. They could get lost in there and not be able to come back to reality. So it's really important that someone has proper reality orientation and is healthy in that way mentally before doing a GIM session. They also need to have proper ego and identity boundaries in place. So they know who they are, they know who they aren't, and there's no question there. So that's also part of orienting to reality. They also need to be able to experience internal imagery safely. So even if someone's not having a psychotic break, someone, say, with trauma might not be able to close their eyes safely, because when they close their eyes, they return back to those experiences that are challenging and traumatic to them. So you need to make sure that the person you're working with is able to experience imagery safely. The client also needs to be able to focus and concentrate and interact. So this comes up in questions about clients who, say, are terminally ill or say have cancer. So in the medical setting, there's actually many reasons why GIM is very difficult, because one, you have nurses coming in and out all the time and interrupting, so that wouldn't work out. But also your client may not have the energy, they might not be able to interact, they might fall asleep. So you need to make sure that they have energy and focus before going into a GIM session. So again, they need to be able to return to reality. They also need to be able to communicate with you. So language will be actually a contraindication here. If you don't know the language that they speak, then this is not going to work because you need to be able to interact verbally. They need to be able to dictate to you what's happening. If they, for some reason, aren't able to tell you what's happening as it's happening to them in the imagery, then it's not going to work because you need to make sure that they're safe and you need to know where they are. And they need to be able to provide feedback. If they're having a negative experience, you need to know that so that you can support them. And they also need to be able to discuss and process and to actually benefit from the GIM session. If it's evident that they're not benefiting, then it's probably not for them. So the more traditional applications of GIM, and there are adaptations and modifications of GIM for other populations, but for the traditional version of GIM, typically it's used with adults seeking ways to do some self-exploration, some self-work, so interpersonal work. It's used to manage psychological effects of medical diagnoses like cancer patients. So this would be more in the recovery process. So they're out of the hospital and they're now starting to process and integrate the psychological effects that their cancer diagnosis and treatment has had. And GIM might be something that they can use for that. GIM can also help with managing and continued recovery of non-psychotic mental health issues. So patients who have their conditions under control, maybe they're medicated, maybe they've gone through a lot of therapy and now they're in a safer space and they can do the more depth-oriented GIM work safely and are reality-oriented, then that would be a good application of GIM there. And GIM, again, it's using for processing and integration of challenging life experiences. So that could just be anybody. It could be someone who's pretty stable in their life and they feel good, but they maybe are challenged by a work-life balance. So GIM might be a good option for them to explore how do they find more balance within the self. And it can be good for just exploration and integration of identity. Like I said, there are modifications for GIM for fragile populations, for younger populations. Typically, traditional GIM is used with adults only, but we're not going to go into those right now. So if you have any questions about that, you can follow up with me and I will have my contact info at the end. So the Bonny method of guided imagery and music was founded by Helen Lindquist Bonny. So Helen was born on March 31st, 1921, and she died in May of 2010. She, at an early age, she was a big appreciator of classical music, as well as her family, and she was a violinist. And she had an experience at a religious retreat in which she was playing for a group of people, and she was playing her violin, and she felt an out-of-body experience. And this inspired her to explore the effects of music and the mind and how it can lead to mystical, is what she called them at the time, mystical experiences. She studied music therapy under E. Thayer Gaston. And she was invited onto the staff at the Maryland Psychiatric Research Center under Walter Pankey, I think it's pronounced. And he was doing research that looked into the effects of LSD in creating transpersonal experiences. And he was looking to use music within these long LSD sessions and needed music therapists to help with this. So Bonny came on board and helped choose music and then also helped within the sessions themselves to guide the participant as they were going through the LSD session to help them stay grounded and to choose music based on where they were. So Bonny one day had a patient who was going to come in for an LSD session with music, and the patient's wife came up to her and said, "I wish I could experience what my husband is experiencing because I'm worried about him." And Helen said, "Well, I can't give you LSD, but I can show you kind of what the session feels like." So she facilitated a session in which the wife laid down on a couch and she started music, and she checked in with the woman to see how she was doing. And the woman had this incredible experience. And when she compared notes between the LSD session and the non-LSD session, what she found out was that the same effects could be found but the person without LSD could actually remember them and integrate them more effectively. So she decided to take what she learned and to develop it into an actual technique. She created a following. She went into her graduate research and beyond, and she developed BMGIM. And then the Institute for Consciousness and Music in the 1970s, and she created trainings and started to spread the word. And so there was an initial group of therapists who were trained in the Bonny method. And today there's the Association for Music and Imagery, which provides fellowship for people who are going through training. And there are trainings all over the world and GIM therapists all over the world. So what are the GIM training requirements? So you have to have a master's in music therapy or a related field. So that could be psychology or social work. And then once you apply, you have to do 3 levels of seminars. So you start with level 1, which is more of a introduction course. And then level 2, you start to learn more about how to apply it. And then level 3 is more advanced work. And all of those together can last 3 or more years. And then as a part of your training, you have to do 85 plus sessions conducted within a series. So that means that you can't have just one session with one client, one session with one client. You have to have 3 or more sessions per client within that 85 sessions. You will be submitting sessions for supervision and feedback throughout that. And then you also have to do reading and research and other education requirements. And then the Association for Music and Imagery, you can apply for fellowship and then you become an FAMI, or a fellow of the Association of Music and Imagery. So I'm going to end with a quote by Carol A. Bush. She says, "The colorful, often emotion-laden world of music and imagery provides a window to view our inner selves. Through turning our senses inward, the imagination, stirred by fine music, enables us to view our feelings, memories, and intuitions." So if you'd like to learn more about GIM, you can, of course, get in touch with me. My information will be at the end. And you can also go to the Association for Music and Imagery. They have a website that has a lot of information. They also have a GIM Fellows directory. So if you're interested in finding a GIM therapist for yourself, you can access their directory at their site. It's free. There's also a Association of Music and Imagery journal that has research that's done by GIM therapists looking at the effects of GIM, both in a quantitative and qualitative sense. There are also a couple of books that I would recommend that give a really great overview of GIM. One is Guided Imagery Music, The Bonny Method and Beyond by Brucia and Groki, and Music and Consciousness, The Evolution of GIM by Helen Bonny. And I also just recommend that you go out and get a session for yourself, that you try it out. It can be a really powerful experience, even if you can only do one, although I highly recommend doing more. It's something that's changed my life, that's been a big part of my own therapy and my own self-exploration, and it's been a really important part of keeping balance in my own life. And I don't think I would ever do any other kind of therapy. So I highly recommend trying it out for yourself. If you're interested in learning more about receptive methods of music therapy in general, there's a really great book, Receptive Methods in Music Therapy, Techniques and Clinical Applications for Music Therapy Clinicians, Educators, and Students by Denise Groki and Tony Wigram. And it has great detailed information about all different kinds of receptive forms of music therapy, including music-assisted relaxation and many different various forms. I highly recommend checking that out as well. So thank you for listening. I hope that you learned something. Please don't hesitate to reach out if you have any questions or concerns. So thank you so much, and I hope you have a great rest of your day. Bye.